Welcome to the introduction of the KaVo amiQa dental unit. You have the option to watch the entire video or select specific sections. Sabine Ludwig will guide you through the training. The patient chair is designed for a patient weight of up to 185 kilograms. When instruments are stored, the chair can be moved in 3 ways. The first option is using the foot control. When the cross switch is pushed forward, the chair moves up. Pull the cross switch backwards and the chair moves down. Cross switch to the left, the backrest moves backwards. Cross switch to the right, the chair backrest moves upwards. The second option is moving the chair at the dentist element. Using the chair cross, the patient chair can be moved up and down, and the backrest can be moved forward and backward. The third option for controlling the patient chair is the assistant element. The arrow keys indicate the direction of movement. If the chair position needs to be adapted whilst an instrument is removed, the home screen can be accessed by tapping the line symbol. When the home screen is visible, the chair can be moved. Then close the home screen by tapping the line symbol again. To release the headrest, turn the rotary knob anti-clockwise and adjust the headrest accordingly. To fix in position, turn the rotary knob clockwise. Alternatively, a 2-joint headrest with push button can be selected. The cushion itself is a reversible cushion. Here you can see the basic position, which is designed for treating adults. For treating children, the upholstery can simply be pulled off, turned, and snapped back on. The transition from backrest to headrest is now flatter. With both options, the head upholstery can easily be replaced with a comfort head cushion with magnetic holder. Remove the standard upholstery, attach the magnetic plate, then fit the comfort cushion. The optional armrests can be swiveled forward on both sides. The armrest facing the device body can alternatively be fixed in place. The dental unit has several safety features. On the backrest, the bracket on the foot switch, in the swivel area of the spittoon bowl, the base plate, and at the foot end of the seat. If a safety cutoff switch is active due to a blockage, a red bar appears on the display and LEDs on the assistant element flash. Details are displayed after tapping the arrow. If a safety cutoff is active, the chair can no longer be moved. In the shock position, the patient chair moves all the way up and the backrest all the way down. This stabilizes the circulation of a patient who is feeling unwell during treatment. The language can be set for each configured user. In the menu, select Settings, then User, then the arrow key. The list of available languages is displayed. We select German, for example. Then back to the overview. The language has been adjusted. We recommend programming the entry and exit position for position 0 and saving an upper jaw and a lower jaw position for positions 1 and 2. This is how the chair positions can be set. Move the chair manually to the desired position. When the position has been reached, press the button to be programmed for 4 seconds. Confirm saving in the pop-up menu. The image on the display changes according to the position. Now manually move the chair to the desired position again, for example, upper jaw treatment. Press the desired automatic button for 4 seconds. Confirm saving and carry out the same procedure for automatic position 2. For treatment, first move the patient into the appropriate automatic position. Then use the manual fine adjustment depending on the size of your patient. If you want them to rinse, you can move them to the rinse position using the SP button. The treatment light turns off automatically. After reaching the rinsing position, please swivel the cuspidor manually towards the patient and back to the parking position. It starts rinsing automatically as soon as the rinsing position is reached, and again as soon as it is left. A signal tone sounds when the parking position is reached. By pressing the LP button, the patient chair automatically returns to the last position and you can continue the treatment. The treatment light switches on again automatically. With the foot control, when instruments are stored, the rinsing position can be called up on the right. The last position can be called up on the left. The assistant element can be used to call up the manual chair positions, rinsing position and last position, as well as the entry and exit position. The home screen of the amiQa can be personalized. Press Settings, select User and press the Home Screen button at the bottom of the following menu. The home screen can now be customized. First, remove the buttons that are not needed. Now, drag down all the buttons for the desired functions. For example, after the shock position, bowl rinsing, cup filler, treatment light on/off, compo shape mode, and screen lock. Alternatively, there is also a bell symbol for connection to a door opener or doorbell available. Once the home screen has been set up, return to the treatment menu. There you can see the newly set up home screen. Not all home screen positions need to be filled. The cup is filled by briefly pressing the cup filler button. The fill level of the cup filler can be set and saved by pressing the cup filler button on the home screen for 4 seconds. The save menu opens automatically and water begins to flow into the cup. By releasing the button, you determine the fill level. Bowl rinsing can also be activated on the home screen with a brief touch of the button, and the bowl rinsing duration can be set and saved with a long press. On the home screen, press the bowl rinsing button for 4 seconds. The save menu opens automatically and the water begins to flow. You determine the rinsing duration by releasing the button. The filling of the cup filler and the bowl rinsing can also be activated from the assistant side and set in the same way. On the home screen, the touch displays of the doctor and assistant elements can be locked simultaneously. To do this, press the button with the lock symbol. The screen lock is required, for example, when cleaning the display. To unlock, the main pedal of the foot control must be pressed for 2 seconds. Locking the screens is also possible from the assistant element. The amiQa offers the possibility of pre-selecting 3 treatment types and saving parameters. Tap on the blue bar. The drop-down menu shows excavation, preparation, prophylaxis, and manual. The treatment types, with the exception of manual, can be individually renamed in the user settings. Additional menu items, such as endodontics, are optional accessories. For example, select Preparation. Preparation appears in the blue menu bar. The instruments used and individual parameters can now be saved for this treatment type. Remove the instrument, in this case a turbine, from the holder. The speed can now be set using the slider. To save, press the Save button. The spray behavior can also be saved. Spray off, spray on, or air only. When the turbine is removed, the preset speed is displayed. By clicking on the RPM value, the speedometer can be changed to show the percentage. The same applies to an electric motor. The desired speed can be selected and adjusted. Select motor left or right rotation and save the parameters using the Save button. In manual treatment mode, no settings for air instruments and electric motors are saved. They can be set individually for each treatment. In the manual treatment mode, there is no center positioning for the foot pedal. When the instrument is removed, the values that were last used are retrieved. The power of the E-scaler can be regulated in 10 stages using the slider. The power can also be regulated via the foot pedal. Please note the recommended power settings. The handpiece can be easily and securely attached to the hose in the specified position. The water volume can be adjusted using the regulating ring. The front grip sleeve can simply be unscrewed, allowing the light guide and LED module to be exchanged in the practice. The left button of the 3-function or multi-function handpiece controls air, the right button controls water. Pressing both buttons together produces the spray. For the multi-function handpiece, the heating of the media can be pre-selected on the display. In the settings, you can choose whether the instrument light is activated when the respective instrument is activated or when it is removed from its holder. This is an overarching setting that affects all instruments. If you have equipped your amiQa with an endodontic or surgical function, you will find all details on the settings and helpful tips in the separate videos on these two options. Five different timers can be programmed in the timer menu. To set a timer, press the arrow key. Adjust the time for the countdown and press confirm. The setting is saved. To start the timer, press the large button. Even when the timer menu is exited, for example for treatment, the countdown remains visible in the status bar. Alternatively or additionally, a stopwatch can also be started. This is also displayed in the status bar. To stop, press the large button again. The first timer can also be accessed via the assistant element. You start your patient communication via the multimedia tab. Detailed information on this can be found in the separate videos on multimedia systems and intraoral cameras. The dental unit offers a range of automatic cleaning programs, including intuitive step-by-step instructions. In the Hygiene tab, tap the cleaning position button to move the chair into the cleaning position. Then select the desired cleaning program. The respective hygiene guide appears on the display. Further steps of the hygiene processes can be seen in the detailed hygiene video. The settings area is divided into personal user settings and general settings. Up to 6 users can be created in the personal settings. The username can be renamed in the user settings. The first 3 indications can also be retitled. Additionally, you will find the language and lighting settings here as well as selection buttons for the personal home screen. In the general settings, you will find, amongst other things, information about your dental unit and the contact details of your specialist dealer. The arm system of the dental unit is adjusted so that it remains at any height under normal load. To hold even with heavy loading, the arm system offers a floating brake that can be adjusted using the screw. The dentist element of the KaVo amiQa is also available as a swing arm. Operating the display corresponds to operating the TM table and cart versions. Only the orientation of the display is in portrait format. The swing arms are available with or without a locking mechanism. The version with locking mechanism has 3 locking positions. Pull the instrument to the desired locking position. To return it, pull the swing arm slightly forward and place the instrument back. To achieve maximum hose length, fully extend the swing arm and it will lock into place. Pull once more and the swing arm retracts. The optional tray holder can be mounted in 4 different positions on the underside and can be positioned flexibly. Once the instruments are placed in the hygiene center, the instrument tray can be removed for sterilization in the autoclave. The foot control of the KaVo amiQa offers a wide range of functions. For example, the stored treatment types can be selected and called up using the main pedal. Once the required treatment type has been selected and the instrument has been removed from the holder, the speed can be controlled using the foot pedal. The main pedal is in the center position and starts the instruments at the preset speed when pressed. The speed can be controlled by moving the pedal to the left or right, here with an electric motor from 100 to 40,000 revolutions per minute. When the pedal is released, it returns to the center position and to the preset speed. In manual treatment mode, there is no center positioning for the foot pedal. The speed can be adjusted continuously by moving the foot pedal horizontally. The pedal remains in the position and therefore at the speed at which it was last operated. The left button of the foot control switches the spray modes when the instrument is removed. The cross switch in the center of the foot control activates anti-clockwise rotation for a motor. The right button triggers a chip blower function for rotating instruments. The enhanced air blast safely and quickly removes debris at the preparation site without activating the rotating movement. When instruments are stored away, the chair functions can be controlled via the foot control. If you have equipped your KaVo amiQa with a wireless foot control, a warning message will appear on the touch display when its battery charge reaches 30%. At the same time, the foot control emits a beep signal each time it is activated. The wireless foot control can be easily recharged with a plug-in power adapter, for example overnight. The on-off switch usually does not need to be operated. It is used to restore broken connections between the foot control and dental unit. The treatment light can be switched on or off on the home screen using the light button. The compo shape mode can be controlled with the compo shape button. The same control options and buttons are also found on the assistant element. The KaVo Lumina can also be controlled via the sensor on the light. Pass your hand past the sensor to switch the light on and off. The compo shape mode is activated when the hand approaches the sensor briefly and is immediately removed again. This activation is also possible directly from the switched off state. Further details on the setting options and operation of the KaVo Lumina can be found in the Lumina instruction video. The assistant element of the KaVo amiQa is compact and functional. It is height adjustable in several stages. After the top locking position, the element can be returned to the bottom position. The compact control element contains the main chair functions, buttons for light control, for the tumbler filler, bowl rinsing and a timer, as well as the display lock for the dentist and assistant elements. An additional tray holder can be fitted as an option. If you have alternatively chosen the left-right assistant element, you can also easily move this to your desired working position. To do this, simply loosen the clamping cap by turning it, bring the assistant element to the desired working height, and fix it again by tightening the clamping cap. The function of the suction hoses can be deactivated for the duration of operation by pressing the foot plate. This function is called vacuum stop. The patient section can be swiveled manually in front of the patient for easier rinsing. To move the chair afterwards, swivel the patient section back into its parking position. A signal tone sounds as soon as the parking position is reached. The signal tone can be deactivated in the general settings. On the Physio Evo, there is a lever located at the front left of the seat. To adjust the chair height, pull the lever. The backrest can be adjusted using the rear lever. Press down until it clicks into place. The backrest is movable. Pull up again and the backrest is fixed. The lever for adjusting the tilt angle is located on the right-hand side. Press the lever down, then the inclination is adjustable. Pull up again and it is fixed again. The Physio Evo F has a footplate for height adjustment. It can be operated with the heel. When the footplate is pressed, the height is adjustable. When it is released, the height is fixed. You can find more information about the KaVo amiQa on our website and in the other videos. Thank you for your attention.